Well, the specialists are running amok. We're not talking about special forces. We're talking about specialist doctors. New York Times article, front page, and there's a whole page, I think it was like A12, there was a whole page that followed part of the article. You go to a general practitioner, and they do a procedure in their office, it's $200. You go to a specialist for the same procedure, it's $25,000. So that should be a heads up. Well, what I want you to do is understand how big this is. This is not small stuff. These types of things cost Americans $750 billion a year, $750 billion, 1/3 of the medical budget. 30 cents out of every medical dollar is either fraudulent billing. In other words, they bill you and your insurance policy or your Medicare account, Medicaid account, for something they didn't even do for you. Or in many cases, they do things for you really didn't need to have done, and they ramp up the bill because they know the insurance and Medicare and Medicaid is going to pay. $750 billion is $750 billion every year. The medical doctors are ripping you off. Now, Bernie Madoff went to jail for life. He ripped off his investors by $3 billion. Medical doctors rip you off for $750 billion, $750 billion. Everybody gets a walk because they're a protected monopoly. They're self-policing. And, of course, those figures are from the Institute of Medicine, not my figures. So what I want you to do is get a hold of that trilogy of books. Remember, in a couple of months, I'll be 75. I have not been to a doctor in 67 years. I've been taking the 90 for life twice a day, appropriate for my body weight, for 67 years. My pulse is 43, my resting pulse. My blood pressure is 90/60. Everything I have, all my blood work and urinalysis, everything is right in the middle. Well, how do I know that? Well, I do that all myself. Okay, I do that myself. You can go to a drugstore. You can actually, many times, you can go to a pharmacy. You can go to a grocery store and get the test strips. For a urine test, they have what they call a multi-stick, and you can find out if you have an infection, urinary tract infection, UTI. You can find out if there's blood in your urine, which can have all kinds of meanings. You can have protein, find out if you have protein in your urine, if you have sugar in your urine, you got diabetes. A blood test, you can find out what your blood sugar is, your A1C hemoglobin, your cholesterol. You can do all that yourself. You don't have to go to the doctor and have them stick a garden hose up your rump and puncture your intestines and kill you. Doing a colonoscopic exam. You can do it either with an occult blood test for a couple of bucks or a fit test. I don't know what they're charging them now, but this is the newest thing. It's 79% accurate when it comes to diagnosing colon cancer, and it's 97% accurate when it's saying you don't have colon cancer. Okay? So the fit test is fecal immunochemical test, and both of those are self-testing, occult blood test and the fit test. You can also do your blood pressure. You can do your own pulse. This is not difficult. I want you to get a hold of that trilogy of books, and Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. And the book Let's Play Doctor, there's a whole chapter on the home laboratory, And you can do your own 6-hour glucose tolerance test. We show you how to do that to tell if you have diabetes or you have reactive hypoglycemia or narcolepsy. You can do all those things yourself. And then it tells you how to interpret all your laboratory data. Tells you how to interpret all your laboratory data. You can do all that yourself, of course. And so what I want you to do is understand this is very, very simple stuff. You can do it. And if you do it, guess what? You'll save yourself a gob of money. You'll save yourself an enormous amount of unnecessary misery, and you'll save your life. More importantly, I think you'll save the life of your loved ones, your kids, your grandkids, your spouse, mama, brothers and sisters, your neighbors, your pastor. We got to start doing this ourselves. The medical system is ripping us off. See, the government had a bad idea. They thought the reason why people weren't getting healthy is there wasn't enough people seeing their doctors, which is too expensive to see the doctor, and everybody needed insurance. Well, the more people who go to see the doctor, the more people are killed. Medical doctors in America kill more people each year than the mafia does in 1,000 years. People say, where do you get that information? Well, how about the Center for Disease Control, the Journal of the American Medical Association, February 5th, 2007. Each year in America, medical doctors kill, injure, and infect 15 million of their patients in their workplace. 15 million are killed, injured, and infected. They go in there for a test. They go in there for a minor surgery. They go in there for some procedure. The doctor is saying, don't worry about it. You'll be in the hospital a couple of days. You're in and out. And they kill, injure, and infect 15 million a year. Front page story, USA Today. I don't make this stuff up. People say, well, how come you're so heavy on the doctors? Why are you picking on them? Well, they didn't give me this information. If they didn't give me the data, I couldn't do it, could I? And so don't be protecting the guy who's killing your kids. Don't be so protective of the guy who's killing your mama. And so I want you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases. If you've had a pregnancy in your family that turned out bad, you need to talk to a lawyer. There has to be consequences for that OBGYN who is managing that pregnancy. If a gangbanger drives down the street and he's shooting at somebody else and kills somebody in your family, I mean, there are the cops. There's the FBI. I mean, everybody's after that gangbanger. Well, what about when a doctor kills somebody in your family? Well, the Chinese, the brothers and the sons of the person who's killed, they go down to the hospital and they kill the doctor. And nobody goes to jail. It's sort of like justifiable homicide in China. I'm not recommending that. But what I am recommending is you learn how to take care of yourself and the people you love. Now, myself, I haven't been to a doctor in 67 years. I've never been on a prescription medication. I'll be 75 in a couple of months. And if everybody in America were like me medically, the medical system would be real humble if all their patients just visit them once every 75 years. Hello? This is how we're going to solve the problem, not by more insurance. Well, stick with us. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I thought we'd talk a bit about type 2 diabetes. As according to the CDC, they say 26 million people in the United States have type 2 diabetes, and that is 8.3% of the population. They say according to the CDC, they predict that by 2050, 1 out of every 3 adults will have type 2 diabetes in this country. And a study recently came out that was published in the journal Diabetology, which I didn't even know they had such a thing, but it's published in there now. And this is researchers from the UK, and they found that eating yogurt 4 to 5 times a week may lower your risk of type 2 diabetes. They looked at the diets of about 4,000 people, followed them for 11 years, found that those with the highest yogurt consumption had a 24% lower risk of developing type 2 diabetes compared to people who didn't eat yogurt at all. They say the risk reduction the study participants saw, those who consumed an average of 4 half-ounce servings of low-fat yogurt per week. The study found an association, not really a cause and effect relationship between eating the yogurt and the lowered risk of diabetes. They say at least part of it is the fact that those eating yogurt tended to not eat other unhealthy snacks such as chips and cookies, cakes, and pies. The researchers found that replacing a serving of chips with a cup of yogurt will reduce the risk of type 2 diabetes by 47%. They say yogurt is a fermented dairy product, contains specific type of vitamin K as well as probiotics. I would contend that probiotics may be part of the reason, but also anyone out there who is thinking they're going to switch their cookies, cakes, and pies for some yogurt, you want to read the labels here, because I did a little study a few years ago. If you recall, Doc, I went into the grocery store and looked at all the top yogurts that were selling that you see advertised on television a lot. And on average, each serving of yogurt has somewhere between 28 to 32 grams of sugar per serving. So each one of those little cups has 28 to 32 grams of sugar in it, and that's added sugar. And we know that having a lot of added sugar in your diet, based off some recent studies, will increase your risk of type 2 diabetes.
That's correct. And of course, I suppose what they're saying is it's an indirect thing. If you eat more healthy stuff, you're not going to be craving the unhealthy stuff, just replacing one bad thing for a lesser bad thing. And so that's not bad. I mean, they're moving in the right direction. But when you have type 2 diabetes, it's easy to resolve. We have what we call the healthy blood sugar pack. You take one of those healthy blood sugar packs per 100 pounds of body weight per month, and you're going to have 2 days sometimes, 2 weeks, 2 months, certainly, you're going to be able to wean down off your medication. Just do what the doctor teaches you to do. Every morning before you medicate yourself, you take your fasting blood sugar, and as your blood sugar drops, you take less medication, get down below 100 on your blood sugar levels for a week, every day for a week without medication. You're an ex-diabetic. We've known for 70 years, Doug, that type 2 diabetes, which makes up 98% of the diabetic population, is in fact a simple mineral deficiency disease. Well, how come my doctor didn't tell me that? Well, why would he take $300 for a cure when he can make $750,000 for treating you for 25 years? Well, my doctor wouldn't do that. He belongs to my church. Really? Even the mafia goes to church. So just presence in church is not enough. That's not enough. And so you don't know why he's going there. Maybe it is a reason because he's a believer. But then maybe he's going there just because he's a wolf and there's a church full of sheep. And so we have to figure that out, don't we? And so if you do these things, it's very simple. And if you want to get rid of your diabetes, type 2 diabetes, get a hold of that book, Hell's Kitchen. Hell's Kitchen. It deals with obesity, type 2 diabetes, and the metabolic syndrome. These are all nutritional deficiency diseases. And you might as well get down to the real cause instead of just trying to manage it. You know, eating yogurt instead of chips is a good thing. That's a good replacement. But I wouldn't worry about the low fat. I would want the high fat, no sugar yogurt for myself. Thank you so much, Doug. That's a great one today. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages. Okay, Doug, let's go to callers.
Let's head to Louisiana. And Beverly, you're on with Dr. Wallach.
Hello, Beverly, you're on the air.
Hello there.
Yes, sir. Yes, ma'am. How can I help you?
I hope that you can just do a lot of good. I have COPD. I have asthma. I have allergies that are just numerous allergies. I'm allergic to cats, perfume, newspaper, print, air fresheners, sweet, just on and on. I smoked for about 25 years. I quit in 1972. And right now I'm already on the Mighty 90. I've been on that for about 5 weeks. And so I need something for all these allergies and...
Okay, well, let's give me a little feedback here. You've been on for 5 weeks for the Mighty 90. We have like 25 different ways to do that. Are you taking the Healthy Start Pack? Are you taking the Pig Pack Plus? What are you taking?
Well, right now I'm on the Go Pack.
Okay, so you're taking the capsules. Okay, very good. That'll work. And how much do you weigh?
I weigh 110 pounds.
Okay, so you're taking 1 or 2 envelopes a day.
Of the Go Pack?
There's 30
I'm
little
taking
envelopes
one.
in each box.
Yes.
You taking one of those a day or 2 a day?
I'm taking one.
Okay, very good. And let's see here. Do you have anything else I need to know about? Any high blood pressure, diabetes, arthritis, back problems?
I don't have any of those problems. In my family line, there are no diabetes.
No, these aren't genetic. These things aren't genetic. Okay, do you have any skin problems, any eczema, dermatitis, psoriasis, or rosacea?
No, I don't have that.
Good. But you do have asthma.
I have asthma. I haven't.
How long have you had asthma? Did you have asthma as a kid?
No, I developed that when I was in Japan back in 1960. I got what they called Tokyo asthma.
Okay, well, that's 50 years ago. All right.
That was, yes.
I'm pretty good with math. Okay. And so, do you have any children?
I have 4 children.
And do any of them have skin problems or asthma?
I have one daughter that has a very oily skin, but she didn't have, none of my kids have asthma.
Okay. Anybody have constipation or diarrhea?
Probably all of us.
Okay. Okay, well, hang on. Get your pen and paper ready. We'll be back, and we'll give you a program. Stick with us. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to Louisiana, back to Beverly. All right. Shar, this is one of your things, I think.
Well, I would guess that she's got a gluten intolerance because of the allergies and stuff.
And the asthma. Mm-hmm.
Yeah, and the asthma.
And the constipation and diarrhea kind of stuff.
Yep.
At 110 pounds.
She's got the products, and they won't work unless she gets on a gluten-free diet.
Yep. So you got to get on a gluten-free diet to get optimal results. You're going to get a little bit of results. If you want optimal results, you got to get gluten-free, as Shar says, absolutely drop dead. Everybody in the household, dog, cat, man, mother-in-law, kids, anybody, grandkids living in the house, everybody's got to be gluten-free. Now, you've passed that gluten intolerance on to your kids because they have belly problems, you said, and so they will pass that on to their kids. Their kids might have asthma. Some of them have asthma. Some have got belly problems. Some get skin problems. It's all the same thing, gluten intolerance. And then, let's see here. Let's go with 110 pounds. Let's go with one healthy heart and brain pack. One healthy heart and brain pack. Take a full dose of each of those products at breakfast. Half a dose of each of those products at breakfast. The other half at dinner time. So that one healthy heart and brain pack's going to last you a month. And I would also get a hold of the D-stress capsules, capital D like David, dash stress. Take 3 of those a day, 1 at breakfast, lunch, and dinner, 1 at breakfast and 2 at dinner. That's 1 bottle a month. And because you have COPD, I want to get more circulation through those lungs so they're going to function better and kind of push blood through there, even though you have a lot of scar tissue in there. So what I want you to do is take the Ultimate Daily Tablets. Ultimate Daily Tablets. Take 3 twice a day. That's 1 bottle a month. And I want you to call us every couple of weeks, if you would, please, Beverly. I want to know your blood pressure. I want to know your weight. I want to know how your asthma is doing. I want to know how your breathing's doing. And kind of take your pulse and write that down, once or twice a week. Take your blood pressure to see how that's going, because that's going to give us a signal indirectly how your COP is doing. And you know whether you're wheezing when you breathe or so forth. Kind of keep track of all that in a little logbook, so when you call us at 2 weeks and 4 weeks and 6 weeks, give us some kind of scorecard, if you will. Okay, we want to know if you're getting better, staying the same, or getting worse, and we'll be able to tweak this thing. We'll be able to walk you through this. Okay, Doug, let's start another call.
All right, let's head to Beaumont, California, and Tara, you're on with Dr. Wallach.
Oh, Tara, you're on the air.
Hi.
Hi, how can we help you?
My question, after my daughter, I had my daughter, it's a few months after, she's 15 months now, I started having gallbladder attacks. I didn't know it at the time, but they were pretty extreme, so I went to the doctor, or the ER, found out I had gallstones. They wanted me to see a surgeon, but I really wanted to do it naturally because I've heard of some of the flushes. Mm-hmm. I did a couple of those. They worked for a few months, but then last week I had a pretty bad attack.
Okay, I want you to stop a minute. Did they do an ultrasound or anything to look at your gallbladder?
Yeah.
Or they just, yes, and what, did they see stones in there or not?
Yeah, they said they saw many stones.
Mm-hmm. Okay. Well,
so,
do you have any skin problems?
Yes, I do. I have eczema.
Uh-huh. And do you have any, you sound a little asthmatic to me. You have any asthma?
I do sometimes.
Yeah, well, hang on. We'll be back after these messages. Doug, let's go right back to California and Tara. Let's see here. So you said you had a little bit of asthma. You got skin problems. Do you have children?
Yes, I just had my daughter, my first daughter.
Okay.
She's 15 months old.
15 months old. Does she have any respiratory problems or skin problems?
She does sometimes. She gets little diaper rashes.
Mm-hmm. Okay. And what do you weigh, Tara?
I weigh 112.
112. Okay. Shar, this is a Shar thing.
Yeah. She definitely has a gluten intolerance. There's no question about it. And for the gallbladder, she needs the ultimate enzymes.
Perfect. Now, what is it in the ultimate enzyme? This will be very useful here.
It's like gallbladder in a bottle. It's got ox bile and
That's it. Ox bile.
Yeah.
Because when you have gallstones, the gallstones are not hard like kidney stones. Gallstones are actually almost 100% cholesterol. And they're soluble in bile, the stuff that liver makes to help you absorb vitamin A, D, E, and K, and good fats and cholesterol, all the stuff you're supposed to absorb. And when they kind of ball up like that and become solid little jelly bean-like things, it's because you're not making enough bile to keep them in solution. So, as you point out, ultimate enzymes is gallbladder in a bottle. So I'd have you, Tara, as Shar said, I want you to take 2 of those ultimate enzymes, say 2 to 5 minutes before each meal, a couple ounces of water. And let's see here. What would you give her, Shar? Are you breastfeeding your baby, Tara?
Yes, I am.
Okay, good girl. What would you give her?
I would give her a Healthy Start Pack 2.0, but I'd also give her the extra Ultimate Daily.
There you go. Perfect. Yeah, the extra Ultimate Daily. You're going to get the Ultimate Enzymes. You'll need 2 bottles a month of the Ultimate Enzymes if you take 2 with each meal. And if you have a burning when you have a bowel movement, like you ate too many chili peppers, back down to 1, okay? And then you want to stay away from all the bad stuff, no fried foods, no processed meats, no oils. And as Shar said, you want 1 Healthy Start Pack. Just cut it in half. Take a half a dose of everything in there at breakfast, half a dose at dinner time. And the Ultimate Daily Tablets, 1 bottle a month. You'll be able to take 3 of those twice a day. And all the nutrition is going to come through your breast milk to your baby, too. So that's a good thing. And it wouldn't hurt for her to start getting a few drops of all your stuff. Beyonce Tangerine and the Osteo FX Plus and the EFAs. Give her a little bit of it. Give her, kind of like a half a teaspoon of everything. The EFAs, just puncture them and squirt one of them a day, just squirt the juice in her mouth, and that will save her from getting asthma. Give us a call every couple of weeks if you would, please, Tara. Okay, Doug, let's go to callers.
All right, let's head to Alabama. And Anthony, you're on with Dr. Wallach.
Well, Anthony, you're on the air.
Hey, Doc, how you doing today?
Okay, sir. How can we help you?
I have a husband and wife, and the wife is on the line. She's got, let's go to him. High blood pressure, sleepiness. He had heart surgery about 5 years ago. He's dealing with headaches.
Wait a minute. What kind of heart surgery?
Miss Houston?
What kind of heart surgery?
Open heart surgery, yeah.
Well,
open heart.
Did he have stents, bypass surgery? Did he have a valve replaced?
He had bypass surgery.
Okay, that helps. What does he weigh? What does your husband weigh?
About 150.
Okay. All right. Okay. Char, we have a guy who weighs 150 pounds. He's had bypass, so obviously has coronary artery disease. He's got high blood pressure. And so what would you do for this guy?
I would give him 2 of the heart and brain packs and give him extra Ultimate Daily to keep keep his arteries back open and make sure they don't plug up again.
Yep, exactly. And what you're going to do is, as Char says, you want to give your husband 3 of the Ultimate Daily tablets twice a day. That's 1 bottle a month. You want to give him 2 healthy heart and brain packs per month. Give him a full dose of everything at breakfast and dinner. That's going to cover 3 of the 4 heart diseases. The other one, I would also give him the D-stress capsules. Capital D, like David, dash stress. That's going to cover all the heart diseases. You got to change his diet. Things got him in trouble. Everybody in the household's got to be gluten-free. Everybody's got to stay away from fried foods. And that includes the dog and the cat. No gluten foods for the dog and cat and the fish and the bird. Kids in the house, mother-in-law, everybody's got to be gluten-free. Everybody's got to stay away from processed meats. Deli slices, sandwich meats, sausage, ham, bacon, bologna, no fried foods whatsoever. No oils, no margarines, mayonnaise, salad dressing, cooking oils, no olive oil, no coconut oil, no oil. And call us every couple of weeks. Okay, on that one. Okay, how about the lady now?
Doc, he also has headaches and fatigue. I was trying to mention that to you.
Yeah, let's just go with this. He'll get a lot of results.
Okay.
I mean, I can give him another $500 worth of products, but let's just go with this. I think he'll see, a lot of benefit here.
Okay. This wife had a car accident, broke her collarbone, whiplash, osteoporosis, rheumatoid arthritis, depression, weight gain, and COPD.
Okay, what does she weigh?
130, 5'2".
135?
130 and 5'2" in height.
5'2". Okay, so she's 20, 30 pounds overweight. All right. All right, Char, what would you do for this lady?
Well, she really needs a healthy bone and joint pack, too. Mm-hmm. She could just get by with 1, probably. But she needs, for all these other problems, she needs the de-stress. I would give her the Ultimate Daily and the de-stress in addition to the...
A+, very good. So 1 healthy heart and brain pack, cut it in half, 1 healthy bone and joint pack, as Char says, 1 healthy bone and joint pack for all the bone stuff and osteoporosis and all the trauma. Divide it in half, take half a dose for everything at breakfast, half a dose at dinner, 1 bottle of the Ultimate Daily tablets, 3 at breakfast, 3 at dinner. That's going to support and promote healthy blood flow through the lungs and help you deal with the COPD. And give us a call every couple of weeks, and we'll walk you guys through this. If you want to, you can actually do the ASAP for the weight. If you want to lose that now and you don't mind buying a bottle of the ASAP, as slim as possible, as soon as possible. Put a dropper full under your tongue 30 minutes before each meal. And after about 2 or 3 days, you'll start losing a half a pound to 2 pounds a day. And it shouldn't take you but 2 months or so to lose that weight, get down to where you need to be. And give us a call every couple of weeks. Thank you, Anthony. Okay, Doug, we got time to start another one?
Yeah, you certainly do. Let's head to Texas. And Bola, you're on with Dr. Wallach.
Hello, Bola, you're on the air.
Yeah, hi, Doctor.
Hi.
My mom is hypertensive. She is on 2 blood pressure medicine, and she's also diabetic. She's on insulin, and she has this continuous pain that goes on in her right arm that disturbs her activities of daily living.
Okay, I missed that. She's got pain where?
In her right arm.
Pain in right arm?
Right.
And now is it in her shoulder? Is that her shoulder or elbow? Shoulder?
It's the upper arm. And it goes to her shoulder.
Mm-hmm. Okay, so what does she weigh?
She weighs 170 pounds.
Okay, well, hang on. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, 90 for Life Crusade. And Doug, let's go right back to Texas and Ebola. Okay, 170 pounds, diabetic. What you do, if you would please, is take 2 healthy blood sugar packs per month. Full dose of everything at breakfast, a full dose of everything at dinner. That'll allow you to have 3 of the sweeties at breakfast and dinner. And I want you to take your fasting blood sugar every morning before you medicate yourself. And as your blood sugar drops into the normal range below 100, you take less and less medication, just like your doctor said. And if you get down below 100 every day for a week with no medication, you're now an ex-diabetic. It happens pretty quick. 2 days, 2 weeks, 2 months. It'll happen very quick. Now, because this lady has high blood pressure, I'd want her to also take 3 of the Ultimate Daily tablets at breakfast and 3 at dinner. That's 1 bottle a month. And then because she has pain in her right shoulder, let's say she got some arthritis or maybe a rotator cuff problem, whatever, I'd go ahead and get 2 large bottles of the glucogel, so you can have 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. And all of that will support and promote maintenance repair of the joints, the cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. And diabetes, as I said earlier, is not a genetic disease. It's not a disease that just happens. It's actually a nutritional deficiency disease. We've known it for 70 years. It's a simple mineral deficiency disease, and the Healthy Blood Sugar Pack is designed to deal with it. So you'll be very excited, but call us every 2 weeks, if you would, please, Bo, letting us know how this individual is doing. I want to know blood sugar, blood pressure, weight, all that kind of stuff. And if they want to jump on the weight thing right away, they can use the ASAP, full dropper full under her tongue 30 minutes before each meal. It'll be 1 bottle a month. And they, after about 2 or 3 days, they'll start losing a half a pound to 2 pounds a day. And the magic here is, Bola, as long as they stay on the 90 for life, appropriate for body weight, they will never gain the weight back, because the weight has to do with what? It's a nutritional deficiency. It's not eating too much or lack of exercise. Okay, Doug, how much time we have here?
We've got a little over 2 minutes here.
Okay, well, let's try another one.
Let's head to McCollum, Texas, and Nicole. You're on with Dr. Wallach.
Well, Nicole, we only have a few moments. How can we help you?
Okay. I'll make it quick. Younger, I had eczema, Stevens-Johnson syndrome. I was diagnosed with lupus nephritis at 19. I have cellulite, hair under my chin, constipation. I get sleepy after eating. I have a white-coated tongue. I have Raynaud's phenomenon, really bad.
Okay. How much you weigh?
175.
Okay.
I'm 5'10".
How tall are you?
5'10".
All right. Tall girl. Okay, Shar, 175 pounds.
She needs 2 healthy, but she also needs to get on a gluten-free diet.
Yep.
But she needs 2 healthy. I would get her 2 healthy bone and joint packs.
Very good. Perfect for the lupus, absolutely. 2 healthy bone and joint packs, and a full dose during your breakfast and dinner, as 15 glucogel a day, 5 at breakfast, lunch, and dinner. All that will be accomplished by the 2 healthy bone and joint packs. And then, because there's lupus, I would also throw in, at her body weight, I would throw in 9 of the selenium a day, 3 at breakfast, 3 at lunch, 3 at dinner. That's 3 bottles a month. Also, with those 2 healthy bone and joint packs, with each one, you're going to get a jar of the CM cream. In any place you have pain, you're going to put that CM cream on. Within 10 minutes, you're going to get significant or total pain relief for 3 to 5 hours. The eczema and constipation will go away in a couple of weeks to a month or so after you've been on a gluten-free diet, no fried foods, no processed meats and oils. You want to make the constipation thing go away faster. You can also get a quart each month of the herbal rainforest and take a tablespoon, a half ounce. And that quart will last you 2 months if you take a tablespoon at bedtime every night with a glass of water. Give us a call every couple of weeks, Nicole. You're going to be a new woman. Okay, how much time we got here, Doug?
We got about 30 seconds here.
30 seconds, Shar. What advice would you give people?
Take care of yourself. Take better care of yourself than you do of your car. Do preventative maintenance, and you won't break down.
Let's see. When was the last time you went for a doctor for being sick?
over 25 years ago. I wasn't even sick then. I don't have a doctor. My doctor died a long time ago.
That's pretty good. Well, if everybody were like you and me, Shar, medically, guess what? The medical system would be real humble. Back surgeons would have to start out tree surgery. Wouldn't be anybody to work on because we're going to take care of America. Good job, Shar. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.